So actually, I'm sorry for my condition. So my leg was broken because of a sport accident. So if you have any idea or solution for quicker tendon healing or exoskeleton, something like that, I'm more than interested in that. So I'm Balázs Gasz. Actually, I'm a cardiac surgeon, and I work here in the University of Pécs in the 3D project. So, and with that group, we try to spread the application of surgical guidance and modeling for many disciplines in clinical disciplines. So, what I would like to present to you, it's an application in cardiac surgery. Of course, on myocardium, so on heart, so which is, it's okay, thank you. So myocardium, of course, it's not a static organ, so it's moving every time. So in every heartbeat, it changes its shape, and also the wall thickness is changing every time, and also the tension everywhere. So firstly, I like to show you an application for surgical planning against left ventricular aneurysm. So left ventricular aneurysm is a bulging or a protrusion of the left ventricular wall. So after a myocardial infarction, so the myocardial wall, the left ventricular wall becomes scurry and thin, and it starts to bulging out, and due to the forces inside this forming sac here, so it's increased its volume, and so something similar like in inner tube of bicycle wheel or something like that. So actually this can cause several troubles for the patient. Of course, here can be thrombus formation and arrhythmias, and also there is a risk for rupture. And we have only one solution for that in general, so in surgery, and it is called surgical ventricular restoration. So that means we try to restore the normal shape and morphology of the left ventricle with excluding the aneurysm somehow. So there are thousands of different species of procedures for that. And once a big orthopedic surgeon said, so if there are more than one application for one disease, then nothing is effective. So and there is no proper way of treatment. So something similar in left ventricular aneurysm. Of course, every patient is different, and every left ventricle is different, and also the extension of the scurry tissue is very different, and we have to reduce the volume of the left ventricle according to several rows. We have read some studies, and there are studies, so we have to reduce the volume at least 30%, with 30% of the beginning volume, and the endosystolic volume should be less than 70 milliliters per square meter of body surface area. So then, it's needless to read this text slide here. So it's all about a young lady. So it's a young female patient who received a so-called Bental operation. It's called the wall aorta and aortic wall was replaced. And this patient also received venous graft for coronary sclerosis due to a myocardial infarction. And less than 1 year, following less than 1 year, this patient presented with fatigue and dyspnea. And the echo examination showed very biggest, it's a huge left ventricular aneurysm of inferior location. So here you can see the CT images of that patient, if it works. So here you can see the left atrium, as I can see, and it's the left ventricle here. And here comes the huge left ventricular aneurysm, almost the same volume as the normal left ventricle. So my colleague found us only for printing out this morphology. So it's a very rare case. It's interesting. It has specialties in relation of anatomic structure, and so it's an interesting case. Let's print it out. So we did this model, so it's cleared for everything else. So it's only the left ventricle and the aneurysm sac and the aorta and the grafts there. So these are the venous graft. And here you can see the anatomical localization of this aneurysm sac. So this aneurysm just arises from the base of the papillary muscle of the mitral valve. And it has the function of the controlling of the closure of the mitral valve during systole, and so it's affected, of course, and also the posterior annulus of the mitral valve is also affected. It's just in the neighborhood of the border of the aneurysm sac, and the left ventricular outflow tract is also in the neighborhood. So a well-planned operation should be for that patient, and this patient has a lot of risk factors, so a quick and well-planned operation should be done. And okay, here it's printed out. So it's FDM for the ventricle, and it's an SLA method for the spider-shaped structure of the aorta and the grafts. So, and we try to go a bit further, and we had speculated that we can use these models for planning somehow the patch which is used for exclusion of the left ventricular aneurysm sac. So firstly, we take the models and we started to draw curves on it, taking into consideration of anatomical structures and thickness of the wall, and also the functionality of the wall. And then we had 3-4 curves, and it means there are 3-4 scenarios or 3-4 morphologies of potential patch for closure. And then we started to analyze the predictive functionality of this left ventricle with the given scenarios of the patches. Firstly, we used this one, so the patch morphologies were imaged on CT of the patient, firstly, of course, also in systole and diastole. And then we could calculate the expected volume of the left ventricle with the different patches, and also the function of the left ventricle. So we have systole and diastole images, of course, with patches, with the same patches. And thereafter, we use this computational simulation method, how it will work, so how the different patch scenarios will function, will work inside this left ventricle, which causes the less tension, which causes the less strain of the left ventricle. Here you can see the preoperative images. So here you can see it's a deaf place. So this sac here, the blue one, it's a deaf place with low flow, and needless to calculate anything else. But here you can see one scenario of the patch, which functioned very well. So it has good shear stress parameters and distribution, and also voltage parameters and distribution of the left ventricle. And according to the function of the left ventricle and this calculation, we have chosen one scenario of the patch. So from the 4-1, and thereafter, we had the patch here, the curvature and the patch. And thereafter, we planned 2 devices for the surgery. Firstly, it's a cutting guy, and it can be used for cutting the shape and the proper size of the patch, even before the operation, or even before the critical period of the operation, because during cardiac surgeries, the heart is stabbed, so the aorta is cross-clamped, and there is no blood supply in the heart, so we have to reduce that time as more as we can. So it's a shaper then, it's a normal patch shaper, and it's an orienter. You can see there are some spikes on it, or it's blunted spikes, which makes the orientation of the patch inside the left ventricle after the removing of the aneurysms. Yeah. So, and it has only one position, because here you can see the markers, so it means the anatomical structures. And if you place it in the proper position, then it sits down and it has only one position, and as a surgeon, you have to sew your patch according to this orienter and no more. So maybe we can avoid some reassessment, do undos and so on during the surgery. Here you can see how it's expected, how the orienter would sit inside the left ventricle. It's from the mitral valve view, and here you can see these 2 guides for shaping and for orientation in the table of the scrubbing nurse. And it's an intraoperative video. Here you can see the aneurysm. Of course, the heart is empty now, and also it's upside down. And on the next picture, it's emptied, and also it's arrested. So it's a very, very different appearance that we had on the CT, or it has normally. So here you can see the aneurysm, so it has a paper-thin wall. And after opening it, we made, of course, the patch sizing and cutting was made. And after placing the orienter, you can place it inside the proper position, and here you can see the patch. So it's sealed down. And thereafter, so it's a pre-operative picture, so with moderate mitral regurgitation in that patient. And here we have a trivial mitral regurgitation only. And the postoperative echo here showed the dramatic so it's an improvement of the left ventricular function. Yeah, we had some residual bulging there. It's also, you can see here, maybe somewhere over there. But the left ventricular function was improved very well, and and also the volumes was as it was expected, and we had a good sphericity index, and mitral regurgitation was solved almost. Yeah. So results. So we could decrease the operation time, perhaps. So we have not so many cases. Improving the left ventricular function, and also the mitral, the function of the mitral valve, and we could avoid the replacement of the mitral valve to an artificial valve in that young patient. So it has a lot of unwanted effects. So, and it's the next case here with huge inferior aneurysm. So that would be the topic for next days. Okay, so thank you very much for the attention.